Facelift reviews. Information on face surgery. Facelift review. Cosmetic surgery details and information on faces. A facelift is a type of plastic surgery that is performed on a person's face and neck to create a more youthful appearance. Let's review the facelift facts. This type of face surgery is more formally known as rhytidectomy, which means the removal of wrinkles. The facelift process is very complicated and only a qualified doctor who has received medical training and graduated medical school should be performing the surgery. Many people have facelifts to gain a more youthful appearance, but some people have them because of trauma that has occurred to their skin, such as in a car accident. This surgery can be extremely physical and emotionally beneficial to the patient if it is performed correctly and if the patient follows the medical instruction of the doctor before and after the procedure. This face surgery procedure consists of a qualified doctor removing excess facial skin off the patient's face, also tightening the underlying tissues in some cases. Usually this process begins with an incision being made in the upper front area just in front of the ear and up towards the patient's hairline, and then the incision is carried around and behind the ear to the bottom portion of the patient's hairline. This might seem like a large cut, but because of the placement and thinness of the incision, the scar is usually not visible at all. After the doctor makes the incision around the ear, he or she will then use a medical tool to separate the skin from the underlying tissues. All the skin over the face has to be separated from the underlying tissues so that the doctor can remove excess skin and tighten it without causing any damage to the person's appearance. If the doctor damaged the underlying tissues or muscles, there could be permanent damage to the person's appearance. After the skin is separated from the underlying tissues, the doctor can use stitches, also known as sutures, to tighten the underlying tissues, or they can just skip this step if it's not needed. After the underlying tissues are tightened, the skin is replaced in the desired location and the face and the excess skin is removed if it is deemed necessary. After the excess skin is removed, the incision is closed with stitches or staples. Although face surgery is a complicated process, it is not as dangerous as many other surgeries. It is also the 6th most popular plastic surgery. So most plastic surgeons have gained a lot of experience with the different procedures, such as an interfacelift. The interfacelift and other types of face surgery are all popular in our country, especially with celebrities. All of the different facelift procedures, such as procedure of the interfacelift, are very similar and require a certified plastic surgeon to perform them. So if you're looking to get an interfacelift or any other type of facelift, make sure you research your doctor before going under the knife. Another type of plastic surgery that is sweeping the nation is the lifestyle lift. The lifestyle lift is marketed as being minimally invasive and only using local anesthesia. Both of these concepts are why it is so popular. Many people want to have a facelift done, but they are terrified of being put to sleep, or they are scared of an invasive surgery that will leave a huge scar. The lifestyle lift appeals to these customers. This type of surgery is just one of many new procedures that are being developed as plastic surgery continues to thrive in the future. The Simone lift is another type of facial plastic surgery that is very popular today, and it was developed by a famous plastic surgeon. This type of plastic surgery is also minimally invasive and is marked on the basis that it barely interrupts your day-to-day life with a very short recovery time. The Simone lift procedure gives patients a more natural result than other facial surgeries do, and this is very appealing to celebrities and other individuals who want to look younger but do not want it to be obvious that they have had work done. This procedure is actually done as an outpatient procedure where the patient receives results the same day that they have the surgery. Another wonderful benefit to the surgery is that there is no need for anesthesia. This is a hot point for many patients since anesthesia is always an added risk. Why deal with the complaints when the Simone lift is safer and more effective than other surgeries? See Dr. Payman Simone's testimonials on his website. Go to the Dr. Payman Simone lift webpage to see testimonials.